Hello everyone. Now in this video I am going to discuss a topic about drug abuse for the subject hospital and clinical pharmacy for diploma in pharmacy first year students. This is the introduction part, that is a drug is something that affects our body, and drugs passes through the body and interferes with brain neurotransmitters. Okay. Now classification of drugs, mainly there are two classification. One is pharmaceutical drugs, for example aspirin, paracetamol, etc. And the second one is recreational drugs, for example alcohol, nicotine and caffeine, etc. So drug abuse and addiction, that is now both group as substance of drug use disorder, is a condition characterized by a self-destructive pattern of using a substance that leads to significant problems and distress, okay, which may include tolerance to or withdrawal from the substance. So commonly there are some commonly abused drugs are there, for example marijuana, cocaine, heroin, alcohol, okay. So this drug use disorder in unfortunately quite common, okay, affecting more than 8% of people, okay, in the United States at some point in their lives. So there are some prescription drugs are also there which may be abused, okay. There is inhalant and solvents, sometimes sedatives, coffee and cigarettes can also be used to harmful excess, okay. So there are some risk factors of this drug abuse, for example genes, okay, it's a very important point. Second one is mental health, third one is family and social environment disturbance, and the last one is effect on the brain. So these four factors basically it mainly involved in the drug abuse section, okay. Genes, mental health, family and social environment disturbance, and effect on the brain, okay. So people in this point I want to discuss some point, that is people can abuse virtually any substance, okay, whose ingestion can result in your euphoric feeling. Euphoric feeling means high feeling, okay. For example inhalants like household cleaners, okay, are some of the most commonly abused substances, okay. While the physical and psychological effects, which are also very important for this section drug abuse, these physical and psychological effects of drug use disorder tend to vary based on the particular substance involved, okay. The general effects of a substance use disorder involving any drug can be devastating, okay. Although this is also very important point, although drug use disorder have no single causes, okay, there are no single causes. There are a number of biological, as I have already discussed, biological, psychological and social risk factors that can predispose a person to developing a chemical use disorder, okay. Now there are some signs of drug abuse, for example your physical warning, under physical warning your bloodshot eyes, okay, pupils larger or smaller than usual, pupils may be large or may be small other than the usuals, okay. Then changes is appetite, okay, changes in appetite or sleep patterns, this is also important point. Then sudden weight loss or weight gain, okay, deterioration of physical appearance, this is also a very important point for this topic, that is physical warning. Then unusual smells on breath, while breathing some unusual smells may be there. Then impaired coordination, there are coordination may be impaired, okay. These are the physical warnings, physical sign. Now some behavioral signs or behavioral warnings are there, for example poor work, okay, decline in performance, financial problems, secretive behaviors, okay, sudden change in friends and associate, accident or trouble prone, lack of motivation and withdrawn, and unexplained anxiety. So there are some behavioral symptoms and behavioral warnings of this drug abuse. Now, drug abuse leads to basically loss of coordination, as I have already discussed, poor judgment, okay, slowed reflexes may be slowed, distorted vision because the pupils of the eye may be smaller, may be larger, okay, these are the symptoms. So because of that, distorted vision occurs. Then memory loss, okay, because as in the causes part I have already discussed that effects in the brain also may be the cause of your this drug abuse. So memory loss will be there, and blackout, complete blackout may be the effects, one of the important effects of drug abuse. Okay, now this is basically the overview of this drug abuse. Okay, so before going to conclude this topic, I want to discuss some more point, that is treatment option of substances abuse disorder remain largely undularized by most people who suffer from this condition. Okay, the primary goals of recovery are your abstinence, replace, prevention, and rehabilitation. So this rehabilitation point, it is very important for the treatment, for the this is the primary goal of this treatment of this drug abuse. Okay, rehabilitation. Okay, so during the initial stage of abstinence, a person who suffers from chemical dependency may need detoxification treatment to help avoid or lessen the effects of withdrawal. Okay, the treatment of dual diagnosis is more effective, while treatment of the sufferer's mental illness occurs in tandem with the treatment of the individual chemical dependency. Okay, so these are the some point that I have discussed. Okay, so thank you for watching this video.